Hello everybody and welcome to the Thursday edition of Video Clips. And today we're going to do something a little bit different. We're going to talk about bad medicine and good medicine. We're going to contrast the two. So I'll just start by saying John McDougall says that people like to hear good news about their bad habits. People in Columbus must be ecstatic after receiving the most recent edition of the Columbus Monthly Health Guide in the mail. And here it is. Could not wait to open this to see what wisdom it would provide. On the cover, it's advertised as the ultimate guide for living healthy and wise. The ultimate guide. So, and it has the best doctors, dentists, and chiropractors in town listed by category. So apparently living healthy and wise includes the list or the use of facial fillers for a variety of purposes. And here's the first article that I turned to. And it says, whether you want to lift, add volume, refine, or define, non-surgical injectable treatments are customizable based on a person's concern and their age. I feel healthy and wise more already just from reading that. Then a 3-page spread. This is where the good news about your bad habits comes in. There's actually a 3-page spread about the benefits of alcohol. All right, now so here are some things that I bet you didn't know. So we'll start with the page on beer. Beer is a diuretic, which you already know because it makes you urinate often. This means moderate consumption can help you avoid kidney stones by diluting urine and strengthening the flow, according to one study. Who knew you could prevent kidney stones with beer? Like wine, beer is good for circulation. A Japanese study showed that small amounts of beer make your arteries less stiff. My gosh. And then, as if that's not enough, keep forgetting your sunglasses, grab a brew instead. The antioxidants in beer, specifically ales and stouts, help cut your risk of developing cataracts. And if you're trying to develop stronger bones, drinking 1 or 2 beers every day can help block the hormones that encourage bone loss. And then, last but not least, beer helps prevent dementia. That's not all. Maybe you're not a beer drinker and you're a wine drinker. We have something for everybody here because here is a whole page about wine. And as alcohol goes, wine is a health powerhouse. It inhibits the bacteria that causes acne. Drink it or rub a little into your skin, but use the cheap stuff. You want to save the really good stuff for drinking. Another irony, even though heavy drinking kills your liver, drinking a glass of wine a day actually helps it. Wine fights tooth decay and gum disease. It's rich in melatonin, a hormone produced by our bodies that regulates sleep and wake cycles, so you'll sleep better if you drink wine. It makes you smarter. Seriously, you can't make this up. Drinking wine makes you smarter, at least you think you're more intelligent after a few glasses. More brain benefits. Drinking wine helps us beat the blues, and as if all of this wasn't enough, here's one more. Wine is good for your sex life, or at least maybe it makes you think it's good for your sex life. Who knows? And then there are spirits. If you want to use the better stuff here, you're at a restaurant, you ate onions, and you're pretty sure you have bad breath. Freshen your breath easily with a shot of vodka. And that's always such a good idea before you get in the car to drive home. Got it. If you're trying to lose weight, try drinking a little tequila with your dinner. Very helpful. The added calories from the tequila, I'm not sure how that works, but all right, you get the idea. Good news about your bad habit. Aren't you feeling, healthy and wise? I mean, we haven't even gotten to the best stuff yet. All right, so then, pretty excited about what I've learned so far. I thought I've got to check out the best doctors because with this type of information, if I need a doctor, I'm going to find one. So they have them divided by specialty. And so I went to psychiatry. I thought that would be a good place to look for people. And right there in the list is James Young, who does electroconvulsive therapy. Okay, he's one of the best in Columbus. Now, I knew what electroconvulsive therapy was, but I thought I would check it out just so you know. So here's what this is. It's done under general anesthesia. Small electric currents are passed through the brain, intentionally triggering a brief seizure. So it's good to, I'm sure that's wonderful. I mean, anything but talk to people, right? This guy doesn't want to talk to people. And as if that's not enough, the ultimate guide, I was still reading the doctor section, features this lovely person, Delaney Smith. Here she is, and she is head of one of the inpatient psychiatric centers in Columbus. Now, this is what she has to say, best doctors. All right, she says that she loves helping people with problems, and one of her favorite ways to do this is what's called transcranial magnetic stimulation. Electromagnetic coils placed on the scalp near the forehead and magnetic pulse stimulates nerve cells in the areas of the brain that involve mood control and depression. Nobody knows how it works. I checked out several websites, but there are side effects which include headache, tingling, spasms, twitching of facial muscles, lightheadedness, seizures, mania, and hearing loss. Dr. Smith says this, quote, I'm reading from the magazine, "It's really nice to have a technological way to treat people." She says that one of the reasons that so many people have depression and the drugs often do not work, so she's glad to have this option. She reports that patients often blossom, the actual term that she used. It must be hard to blossom while having your facial muscles twitch or having a seizure, but maybe the manic episodes balance that out. I'm just trying to figure out how these people arrive at their conclusions. Well, with these psychiatrists, people like this, I mean, they must just be willing to do anything but have a conversation with a person who's really hurting and try to figure out how to help them. So this is the worst of healthcare. And unfortunately, magazines like this are prevalent in every community. A lot of city magazines put out this kind of stuff. The Columbus newspaper puts out a health guide every few Sundays. They have a whole special section on health, and it's filled with ridiculousness like this. The other thing that I'll mention is the Columbus newspaper also features a health section or a cooking section on Wednesday. And I was looking at it this morning and should have brought it into the office to use as an accompaniment to this. And all of the recipes, I'm talking about 100%, have between 8 and 16 grams of fat per serving, even the vegetarian ones, full of oil, full of cheese, and unbelievable. All right, so you guys know that I'm highly critical about traditional healthcare and traditional approaches and the mythology. I mean, I know people are reading this and doing something about it, or they wouldn't keep putting it out, right? So let's talk about something a little bit more positive. And I guess I just want to balance it out. And one of the reasons is that I have a pretty big following, and people think that they've been harmed by medical care, and so we need to talk about these kinds of things because that's a lot of what my work is all about. But once in a while people will say, well, is there anything good you can say about medicine? I mean, do you think that anybody's doing the right thing out there? Should anybody ever go see a doctor? Well, to be crystal clear, I've never suggested that anybody should not go see a doctor. I mean, I think everybody probably does need to have a doctor. It's the interaction with doctors under unnecessary circumstances that are part of the problem. But in the spirit of trying to be fair, I want to share two stories that I found this week, actually, about traditional doctors and how, when medicine is used in the right way, amazing and productive things can happen. So the first story takes place in Germany. In 2015, a Syrian refugee, a child, arrived in Germany with his parents. The child had a life-threatening genetic condition called epidermolysis bullosa. That's a mouthful. What this is mutated connective proteins prevent the epidermal layer of the skin from attaching to the dermis layer. This results in blisters, large chronic wounds, incredible levels of pain, and patients can have a very high risk of infections. They're real common, skin cancer, and even death. So upon arrival in Germany, the child was in such awful shape that the doctors who saw him basically said the best we can do is palliative care. They thought he was most likely to die. But that didn't happen. Instead, some of the doctors at this center called on researchers who had performed some experimental procedures transplanting skin cells. And it had been successful on a small scale, but it had never been done on the scale of somebody who was from head to foot covered with skin that needed to be replaced. So the docs took a biopsy from what little undamaged skin was remaining, extracted from it cells that were modified and grown in culture, and then they grew sheets of normal cells, which they transplanted onto the child in order to help close the wounds and all that sort of thing. Well, follow-up treatment or follow-up examination and biopsies showed that the new and better epidermis had adhered to the dermis like it was supposed to and displaced all of the awful, rotting, infected skin that was covering the child when he arrived. 2 years later, the boy's normal, he's in school, he exercises, he plays soccer, and he doesn't have any blistering skin or wounds. And I think that's a happy story, and this is westernized medicine at its best. And then another one I'll share with you was in the New York Times, and it took place in the United States. Full-term baby was born in Houston recently and underwent surgery as a fetus at 6 months gestation to treat a severe form of spina bifida. In babies with this condition, the tissue that should enclose the spinal column doesn't form, leaving the spinal nerves exposed, and then damage to the nerves can cause all kinds of things ranging from incontinence and an inability to walk. The opening can leak spinal fluid, the base of the brain can sink into the spinal column, a lot of harm due to this type of pressure. Well, the parents lived in San Diego at the time, and they told the Times that they were given a lot of doom and gloom, but decided to take matters into their own hands and start researching what their options would be. They found a doctor in Houston who had developed a new procedure which involved making tiny slits in the uterus, inserting a miniature camera, and using tiny instruments to repair the defect. This isn't the only available option. I mean, other types of procedures are performed in utero. But what this doctor was doing was the most minimal procedure possible in order to allow the woman to deliver the baby vaginally, and it also made it less likely that the baby would be born prematurely. The only follow-up procedure so far was immediately after birth, the 2 incisions made on the baby's sides during the surgery to loosen up some skin to cover up the hole. Had not entirely healed, so they had to suture those together. But within a very short period of time, the baby latched onto the breast and started feeding and is fine. Now, the doctors are real clear. This didn't cure the condition, but it lessened the disability. Time will actually tell. The parents told the Times that they were glad they did their research and didn't buy into the doom and gloom scenario. So this is what we're all about here, is helping people to realize there are other options besides just the one that's being presented to you, and often those are better options. Well, both of these stories are examples of how today's medicine can shine. I'm not anti-medicine, I'm anti the misuse and abuse of medicine, and that's what I usually talk about in these weekly videos. It's not the heroic, amazing, life-changing, fabulous outcomes that physicians like this are producing. It's the trying to use these heroic efforts on people who have chronic disease and conditions for which they're not appropriate that I talk about. So we'll continue to insert some happy stories in the midst of all of this doom and gloom that I talk about in terms of the state of medicine, because there really are good things going on out there. And there are good things going on with more and more doctors coming around to wanting to have more collaborative relationships with their patients. All right, that's all for today and all for the week. As usual, pass this on to anybody who you think will enjoy watching it, and I'll be back to you on Tuesday with more news.